talk about COVID-19 because Vice President Dr. Bawumia has urged Ghanaians not to lose their guard by ditching the culture of wearing face masks despite the decline in the number of active cases. Addressing a meeting of stakeholders during the presentation of a report by the Operation COVID-19 Safety Task Force in Accra, he reminded Ghanaians of the threat posed by the virus and the need to respect all COVID-19 protocols to stay safe. That, according to Vice President, is the surest way of preventing a resurgence of the virus.
Today, we are opening up a bit, but still, we've had to put a lot of precautions at the airport, make sure people are tested before they come in and tested after they come in. Initially, people were wondering why do we have to test people when they've already been tested outside. But so far, for the people who have come in, we found 15 people, even though they were tested negative outside. 15 people have been found to have tested positive once they arrived here. So it sort of justifies that second test. Otherwise, those 15 people would be in the system and they would think they are negative. And once the numbers increase, the 15 could easily increase to 500. And then you would suddenly lose control, and we have to make sure, because the nature of the virus is so unpredictable, and spikes keep coming up, you know, whether you're talking about New Zealand or Europe now. Europe, there's a round of spikes taking place, even in countries that thought they had control. And so we should never, never think that it is over. I think that we have seen, some decline in the spread of the virus. There's no doubt about it. And I think it's clear that the work of everybody, but we've worked as a team Ghana across on this matter. And it is coming, it's very, very amazing what has really happened. And we have eased as, systematically as we go. But I think we should never think it's over. And so we pray that one of these days the vaccines, effective vaccines may be available that we can trust and that we can then use for our people. But until then, I heard the U.S. Center for Disease Control Director said that the best vaccine is the mask. He says the best vaccine you have is the mask. And so we should all wear the mask.
Minister of National Security Albert Kandapa made a special plea for the establishment of a National Emergency Relief Fund as Operation COVID-19 Safety Task Force Committee report reveals shortage of PPEs nearly marred the country's management of the global pandemic. There's also suggesting that the handling of the pandemic must be made a blueprint to strategically position the country to swiftly and effectively manage future pandemics.
It's become good news that there is a need for a strategic national stockpile, which we will talk about, and we think it should be taken very seriously. We believe that it will be useful, Your Excellency, if you will have a National Emergency Relief Fund, such a fund, if it did exist when we started all this, could also have been very, very beneficial to have made funds readily available for the team, the partnership, to have fallen on at the time that we were trying to solve this problem.
5,527 persons had the cost of their quarantine borne by the state. Ghana's infection rate is 10.2%, lower than the West African average, with a recovery of 97.98%. Ghana's rate of recovery is higher than the West African, and world averages. Similarly, the country has one of the lowest fatality rates in the world, and that is about 0.64%. These indicators point to the effectiveness of the measures implemented to combat the COVID-19. And to this end, as the Vice President, we want to use the opportunity to thank His Excellency the President, your good self, your government, and all those who made this possible. Having said this, the Vice President, there were a few challenges that were observed. Due to the higher global demand for PPEs and other medical supplies, there was a shortage of these essential medical supplies. This impacted on the activities of frontline responders. Delays in testing could also be attributed to this. The national medical stores could form the nucleus of such an entity if established. Even though government made adequate financial provisions for the national containment effort, the late release of funds to frontline agencies, example daily allowance, especially contact tracers, demoralized them and nearly marred the work of the committee. The operational capacity of Ghana Health Service was challenged due to logistics and staff constraints.